Wound infection is particularly of concern when injured patients present late for definitive care or in disasters where large numbers of injured survivors exceed available trauma care capacity. Types of wounds: lacerations, tearing of the skin and tissue; contusion, a bruise or yung pasa; abrasion, graze loss of the superficial layer of skin; incision, a straight clean wound; punctures, single or multiple, with or without bleeding resulting from any trauma. Puncture is also caused by a sharp object which may still be in the wound, or ito yung tinatawag natin foreign or embedded object doon sa sugat. Prevention and control for wounds: avoid walking barefoot, wear slippers all the time, clean wound and apply antiseptics and dressing. Apply direct pressure to any bleeding wound. Seek the assistance of health workers in the evacuation camp or relocation site for tetanus immunization. Consult the health workers for further treatment and management. Dealing with major bleeding caused by the wounds. Major bleeding is life-threatening and requires urgent first aid intervention to prevent further loss of blood and the development of shock. First aid steps for bleeding. First, expose injury and elevate above level of the heart. Second, if there are no foreign objects, apply firm direct pressure over the wound. Third, if there an object, apply pressure around the foreign object. And 4, call for emergency or medical help. A useful mnemonic to help you remember the first aid steps for major bleeding is called PEEP. P stands for position. Position the victim in a safe, comfortable position. E is for elevate. Elevate limbs. Another E is for expose or examine the injury. Check for any embedded or foreign objects such as piece of glass. P, pressure. Apply direct pressure over the injury to control blood loss. A puncture wound occurs when an object pierces the skin and enters into a tissue of the body. Punctures may occur due to any sharp objects such as glass, scissors, knives, pins, nails, wood splinters, and sharp stones. The object may remain embedded in the wound or may have passed clean through the body part involved. What to remember? First, do not remove the object unless it is very small, for example, small splinters. Second, stop the bleeding by applying pressure around the wound. Take care not to dislodge the object. Third, if possible, elevate the limb to prevent further blood loss. And fourth, seek urgent medical attention. It is important to keep the object as still as possible to prevent further injury to the deeper structure below the skin. Dealing with minor wounds. There are some simple first aid steps you can take if someone has suffered a minor wound. First, wash your hands and wear gloves. 2. Clean the wound thoroughly with antiseptic wipes or clean running water. Third, cover the wounds using a clean dressing, for example, plaster or non-adherent pad, and etc. Caution: do not remove any embedded object. Sometimes, minor wounds can become infected. You should watch out for signs and symptoms of an infected wound. First, increasing pain. Second, area around the wound became red, swollen, and warm to touch. Third, the wound starts producing discharge or pus or yung nana. Third, the casualty develops a temperature or fever.